one of the things that we think about in breast cancer are looking at these T cells in the tumors of patients. When we look at a tumor, and so this is sort of up in your upper right-hand corner of the screen, this is a cross-section of a tumor taken at the cellular level with a microscope. And each time you see a little brown dot, this is a T cell. So we've done a stain, an immunostain it's called, for T cells. And you can see that it's really interesting here when we've outlined the tumor with a dotted line that most of the T cells are outside of the tumor. And there's very few T cells that are actually what we call infiltrating in the tumor. So this suggests that there's a whole bunch of T cells that are just kind of waiting on the outside. They're kind of like, you know, the army ready to charge, but there's very few soldiers that are actually in the field. And so when we use these new immunotherapies, and these are some more pictures at the bottom of the same sorts of tumors, where beforehand we have very few T cells, the pre-treatment on the left, we have very few T cells in that tumor. But when we use immunotherapy against these tumors, you start to see more and more brown spots invading into that tumor region. And finally, after a week or two later, what you end up seeing is that the tumor shrinks down to a very small size, and pretty much everything that's left within that tumor region is all T cells, which means there's no tumor cells. It's not even really a tumor anymore. But what's neat about this is that this activity precedes tumor regression, which means that if we've given these patients only 1 or 2 treatments, we might not see any change in their tumor size, but we can actually look at these infiltrating T cells within their tumor to determine whether or not they're going to have a substantial response to the therapy. Or if we don't see any T cells coming into the tumor, we know that patient is unlikely to respond to that therapy. We could switch them to something else.